It's no secret that COVID-19 negatively impacted the mental health of millions. And since in-person therapy wasn't readily available, thousands turned to their phones for help. Since then, the digital wellness market has skyrocketed. Online therapy, life coaching, and personal growth strategies are all made available by simply pressing download on our phones. But while mental health apps have helped lower the barrier of entry into the wellness industry, how much trust should we be placing in this simplified treatment option?
There's thousands upon thousands of them, and they vary in quality. Basically, any manufacturer can say that it's helpful without studies necessarily backing that they work.
That's Dr. Stephanie Collier, Director of Education in the Division of Geriatric Psychiatry at McLean Hospital. She says most of these programs aren't closely regulated by the FDA because they fall under the wellness category. However, users are continuing to blindly place their trust and mental health in the hands of app manufacturers. Collier says some of these programs can be helpful, but only as a tool to supplement sessions with a licensed therapist.
They can help reinforce skills that were learned. They can also be helpful in tracking, for example, steps if a patient is working towards physical activity goals. But the data is not there for any apps to suggest that they work as standalone treatments. So the type of patient that may benefit from an app is a patient who might experience some stress but not a serious mental illness, unless they're in an established therapeutic relationship.
So why are more and more people using wellness apps instead of seeking professional help?
Well, there's a couple reasons. The first is therapy is very hard. Therapy requires time, effort, and an available therapist. And that has been increasingly difficult, especially with the COVID pandemic, to find therapists that are available to treat patients. So there is convenience to an app. It's at the click of a button. It's something you can download as long as you have a smartphone. So it's convenient. In many cases, apps are free, and very often they have high promises. So patients click with the hopes that the apps can help them.
But Collier warns that most digital programs in the mental health space won't give users the help they're seeking. Her caution stems from the lack of regulation for these types of apps. Collier says the online mental health space has become a wild west. Companies can slap the mental health label on a digital program without any science or testing to prove their claims.
It's a little bit tricky as a consumer to go through apps to figure out which ones could potentially be helpful and which ones are not going to harm you. Some apps also prescribe information that is not helpful to patients. It might tell them to drink alcohol if they're feeling down, or the quality is really variable.
Collier says that even the apps under FDA regulation aren't as thoroughly scrutinized as other therapeutic tools.
So right now there are apps for substance use disorders, but the FDA regulation for apps is different. The standards are different because the apps are considered low risk by the FDA. So the amount of evidence to show that they work is less than they would need for trials for, say, a medication.
The FDA actually loosened its guidelines for digital health therapeutics during the pandemic. It was meant to help increase public access to treatment options by allowing companies to fast-track their products. Unfortunately, some companies are now taking advantage of the lax rules, potentially putting unsuspecting users in harm's way. Collier says HIPAA, the law that protects patient health information, doesn't apply to most wellness apps, meaning these programs are able to sell your sensitive information.
As a customer, you have to be very careful about which apps and what the privacy apps specifically state. And very few apps actually state their privacy policies. And in some apps, you have to first put your data into the app before the privacy data is available.
So in many cases, users sacrifice their personal data without getting much in return. Collier says there's no real evidence that wellness apps help treat mental illness.
Research is ongoing and apps are still being developed, but at this moment, we cannot say that an app is sufficient in treating symptoms of mental illnesses. Apps can be useful in tracking your steps to make sure you're getting physical activity. If you're motivated, there's a use for apps. If you're someone who wants to make sure you're sleeping well, you can look at an app and see that you're getting a few hours less of sleep, and you can make changes to your sleep. So they can be helpful, but we cannot say they are treatments at this time.
In fact, Collier argues many of the benefits people experience with mental health apps aren't exclusive to that specific program. This effect is called a digital placebo.
Interacting with some sort of an app can be helpful in itself. So sometimes when people study whether an app is helpful, they compare it to a control group, say a wait list. And then they see, oh, people using the apps improve and, symptoms of depression or anxiety. But when they compare people using the app to people using a different type of electronic app that might not have the active ingredient, they realize actually both groups improve. So there's something therapeutic for a patient about using the app. And so the effect of the app actually goes down when you compare it to people who use some other type of digital therapeutic.
However, if you're wanting to find an app to supplement your therapy or even just to help calm daily anxiety, Collier knows what you should look for.
I generally recommend evidence-informed apps. So a helpful tool usually has some data behind it. The apps that I recommend are generally developed by the VA in Stanford, and they are the apps that have excellent security features and privacy features and use evidence-informed principles that are continuously being studied. And those apps include CBT, so Cognitive Behavioral Therapy for Insomnia apps, or an app called PTSD Coach for post-traumatic stress disorder. Those apps have sufficient data behind them and high security features.
Even if a program passes the initial checklist, Collier warns to always take a careful look at the privacy policy.
There was one app that I previously had recommended, which I no longer recommend, because the privacy policy states that they can sell your information and they provide your information to third parties. So going through an updated privacy policy is probably the number one thing you can do as a customer.
You can find more information about Dr. Stephanie Collier and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. This segment originally aired in June 2022. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.